Opinions expressed by the guests and contributors on Conklin and Company are not necessarily those of 13 ABC. Now, Conklin and Company continues with Take 3, commentary and analysis from our panel of political contributors.
And welcome back, everyone. Take 3 focuses on health care reform, so-called Obamacare today, with Marlene Harris Taylor, the health reporter from The Blade. And here comes this deadline.
Yes.
Here comes spring.
Yes.
And here comes the health care reform deadline for those uninsured to sign up or face this penalty, Marlene. So how are we doing?
Well, you know, you brought up an interesting point that I want to get out right off the top is that you said the uninsured. Because there's so many people out there who are really confused, and even though they have health insurance, they see these reports in the media and they think they've got to do something. So people on Medicare, people who are already on Medicaid, people who are insured through their workplace, they have to do nothing.
Right.
It's just the people who are uninsured.
Well, we heard
right
so
now.
much. I mean, we've heard so much that, from President Obama, who will, you know, probably look back and say, maybe I shouldn't have said that. If you like your plan, you can keep it. This is separate.
This is separate.
Yeah.
This is totally separate, and I think he really regrets
Yeah.
saying that now. But they have to get, the uninsured folks have to get signed up by the end of this month. April 1st is the drop dead date. If you don't have health insurance by April the 1st.
Yeah, let's take a look at that graphic.
Okay, we got a graphic on that?
We've got some
Okay.
numbers that we can show here. The March 31st deadline, so basically March 31st.
March 31st or April 1st,
April
whichever
1st,
way you
right,
want to say it.
right.
If you don't have health insurance by that deadline, then you're going to get assessed a $95 penalty or 1% of your household income, whichever is greater, this year. Now, you're not necessarily going to have to pay that this year. What's going to happen is they're going to assess that next year when they're looking at your income tax. And if you don't have health insurance.
It's like putting your sidewalk in, right? It's going to be in your taxes, right?
Exactly.
Okay.
And you might see $95 missing
right,
from your tax return next year. Now, every year after that, however, it starts to get bigger, that penalty.
Yeah, significantly bigger. And here, the devil's in the details here.
Yes.
$325 per adult. That's a hit.
That's a hit. I think people will start to feel it at that point. And that we're talking, you know, next year.
Right,
If you
2015.
don't have it. 2015, if you don't have it, you'll get hit with that amount of money.
We heard so much early, Marlene, about the navigators, and that the navigators people are having trouble getting connected to these so-called navigators. And of course, you know, we heard so much about the problem plagued rollout.
Yes.
Back in October. It's gone a little more smoothly since.
A little more smoothly. Let's talk a little bit about who these navigators are. Now, the people can go out, what we're showing right now is the website. So folks can go on their own, they can go out to the website, .gov website, healthcare.gov,
Healthcare.gov,
and you can enroll on your own. You don't have to have a navigator to help you. There's also an 800 number that people can call on their own. These are folks at the national level who will help you on that 800 number get enrolled.
How easy is the website? Have you gone through there?
You know, I actually haven't been on the website lately, Lee, because all the reports that I've gotten lately is that things are going pretty smoothly on the website. So all those early problems that people heard about that you couldn't get on, that you'd get on and your information would be missing. I'm not saying that people will have 100% success, but it's way down from what it was before. So most people are not having problems. But where those navigators come in is if folks feel like they need a little help getting through the process, or if you don't have a computer at home, you don't have Wi-Fi at home. What they have, they gave grants to local communities to hire and train folks just to help people sign up for this. And here in Toledo, there's 2 organizations. There's CareNet and the Neighborhood Health Association that received that grant money. They've hired navigators. There's about 20 navigators for the entire Northwest Ohio, not just the city of Toledo, the entire Northwest Ohio. So that's not a big job. That's not a whole lot of folks. And what they do is they set up at local libraries, at the United Way downtown. They go out and speak to church groups. They do information sessions, but they also bring computers and actually sign folks up right on the spot.
We've heard so much about this deadline that it could possibly be extended. What's your feeling?
You know, I don't know, Lee, because you think about back in December, when people were trying to get signed up by January 1st because they wanted to let me back up. If you were signed up by mid-December, that meant your health insurance started January 1st, right? And a lot of people wanted that to happen. So we got to that mid-December deadline, and the Obama administration kept inching it. Well, okay, you can sign up by tomorrow. Well, if you didn't get signed up, you can sign up by tomorrow. So I would not be surprised at all if at the end of this month, if there are folks, you know, just lined up trying to see navigators, if they see there's a surge of folks trying to do it, but they haven't been able to get through. I wouldn't be surprised if they extended it a little bit.
And it's key to try to become insured through healthcare.gov to get the subsidies, correct? To get the discounts.
I'm glad you brought that up, because that's another thing that people are really confused about, because people hear numbers of what they'll have to pay for health insurance. Now there's several levels of plans. There's platinum, there's gold, there's silver, there's bronze, right? But when you sign up under these plans, then you can get some tax subsidies or credits depending on your income. It's a sliding scale to help you pay that premium.
All right, and with all this in mind, we are running out of time. There is a number, it's an easy one. If people still
Who can diagnose your